Okay, good morning everybody on my behalf. So as was said, we are a tech investor. Healthcare is not our focus. We have done a few of those, for example, Better Doctor, which is very much around doctor data focused on the US and the health plans. I also personally invested into dentist camera shooting video from your mouth, Photodentist company, so some experience from there and also following the field very closely. But I tried to capture here actually 5 trends that I'm seeing now when looking into the health, where the tech startups and the VC investments are going, and trying to more like give you a layman's perspective that what do they mean and where is the industry heading. So let me run through them. The first one is artificial intelligence. I think artificial intelligence is something that everybody are talking about, but I think that there is a lot of people who are thinking that they should do something, but they are not going because it's so hard to understand where to start. But I think today's so-called artificial intelligence spring, which is AI is hot again, is driven very much actually by one technology only, machine learning. And here is a so-called machine learning pipeline, which basically takes in data, which you need to clean, acquire, and polish in order to actually then use it into what we call a model. You are building a model using that data and the machine learning, very often human actually helping that. You say that the model is predicting that, hey, this person might have this disease. Is it right or wrong based on the doctor's input? And you learn. And then you basically deploy, maintain, and retrain your model and getting from your business goals into the results. And the beauty of the machine learning is that you don't need the expert know-how to start with actually to build these models. The data will be used to build the model, and that's why it's so critical to acquire a proprietary set of data that you start to apply into this system. And the best thing you can do is to today, in any business, actually take this pipeline, get some data scientists and start to work on it, because it's going to just get better every day, and those who start later will be in disadvantage. Here are some of the areas where AI, machine learning is getting applied. I just picked, it's more like a random example of companies here that just to highlight you that there isn't any area in the healthcare industry where you cannot apply this one if you have some data. Whether it is diagnosis, predictive care like Lumiata is doing, they are predicting individual chronic diseases. When you provide your individual data, that gets compared to the larger data set and it learns and predicts that what's wrong with you. You have a mental health, you are training people to basically, if they have an issue with their mental health, you provide through an application your, for example, mood analysis, and you get personalized treatment program. Then there are companies like virtual assistants. Dr. AI is one example, where you through a mobile app basically take like a video or photo and you pinpoint, I have this problem, describe the symptoms, and the AI is providing through a chat interface you the first sort of the set of advice and what to do, etc. Or more scientific drug discovery. 2AR is a company, they are taking huge amount of data and doing early analysis for drug discovery using AI. Or a Finnish one, which I find very interesting one, in a medical research, web microscope or FIMIC, which is basically taking a huge amount of data in a scientific research and analyzing that through deep learning and getting results from there. Then you have, of course, you cannot go anywhere without running into Watson nowadays, or DeepMind from Google, or Palantir, which is a Palo Alto-based well-known AI expert. These companies are working in everything you can imagine, very often saying, we can solve your problem. Probably they can, but very often you need a special expert to actually connect that expertise into your field and the gap between the, hey, here is the generic AI application or platform versus your application. So we are going to see a lot of companies innovating in this space. Second trend is what I call a doctor's office of the future, from reactive to a proactive care. And here you can see two examples what I mean. There is a Silicon Valley example. Forward is a recently launched startup that is providing you with $149 a month subscription, more or less, which you pay 1 year in advance. You will be not treated when you are sick, but you will get, you will be body scanned, you will be different sort of the tests will be run on you when you are still healthy. And then based on that, they are creating a profile, call you in a regular basis, you get the sort of the all kind of advice, etc. prior to you get sick. So actually what the future doctor's office is trying to prevent you getting sick rather than taking the current model where you walk into a doctor's office when you are sick, you explain your symptoms and get the treatment. In Finland, there is an innovative startup called Healthy, which is in a slightly similar model, but in a slightly different field. They are in employment care. So in Finland, you have a mandatory provision of healthcare by the employers to employees. So basically, they are providing 59 is the what they call profit up person per month. So a standard payment for a company. They always know that we only pay this much per person. And these guys are trying to keep the guys out of the doctor's office by doing proactive healthcare. So big trend, and we are going to see more of these kind of companies emerging as startups in this field. The third trend is what I call data liquidity. Data liquidity is something that where you connect the data and the doctors. How often you still have the experience that you walk into the 15-minute slot with the doctor, I got sick, and then the doctor is without any prior knowledge, basically ask you that what's wrong with you. And then you explain, and then you basically, he or she will give you a medicine or some advice, and you walk out. It's basically a random sort of the event that where there is no prior knowledge what has happened. And at the same time, you might be one of those persons like me that you are carrying all of these gadgets and measuring your how much did you sleep, what's your blood pressure, etc. And in that way, there is no connection between this world. No, I'm kidding. This world and this world, and there's a huge opportunity for companies to provide the platform to connect that data from different devices, from different sources, not only to the doctors, but health providers, insurance companies that are now creating new business models around sort of that, hey, if you provide your data, you get discount, etc. So I found here, I picked two companies. There are a number of others that are active in this field. Human API provides a platform to basically get any data from any health data from any source to any destination at any time in a secure way. And this is what is called data liquidity. Data liquidity means that the data is available at the right time for right purpose, etc. And I think there are a number of sort of the solutions here that are trying to solve this problem, but the question there is that will there be a nationwide or even global standard that would enable this to happen in a much wider scale? Because sort of the spot solutions won't do it. You have one company doing this solution, the other one next one. So how many sort of the services can the doctor take on or the insurance companies take on? Of course, early days there will be a number of attempts, but I believe that there's opportunity for somebody to take on this problem and create at least somewhat scale here. There is another company here called Velmo. It's a Finnish one. They are in a little bit in the same business as Human API. They provide this data connectivity, but also a platform for creating services and apps on top of that for health companies. So different approaches. I think based on my knowledge, Human API, they have something like 1 billion samples. They have close to 200 million transactions going on there and growing. So quite interesting company to follow where they go in this data liquidity problem. The fourth one is blockchain. I think everybody has probably heard blockchain is going to revolutionize the world. So blockchain is basically, those who don't, it's a distributed ledger. So if you have a transaction, that transaction gets recorded in every node of the system. In that sense, basically as the system grows and grows, the information is more and more distributed, and if you cannot kind of hack the system. So even if you hack one, in some ways, if that were possible, the others would have the same information. So it provides a non-central, trusted entity for any data, in this case, health data. And there is a platform called Ethereum that is providing the basic Bitcoin algorithm to run. But then you have a number of companies that are, for example, Gartner developed their own, not based on Ethereum. Then they are working with or provide the Estonian health data management system is built on a blockchain, so quite advanced. Our cousins from Estonia. Then there is another one here, health data management. There are a couple of companies that are based on this. They took this platform and have built their their services on top of that, on top of the Ethereum blockchain. So blockchain is a big trend, but it's only an enabler. So we are going to see a number of applications built on top of that, and healthcare is one of the hottest area for investment and startups in that area. The last one I had was AR, VR, so augmented reality, virtual reality. I pick up 3 examples. First one is therapeutic exercise training, Mind Maze, where they are basically, if you have a problem, needs to rehabilitate yourself, you are using AR to provide all kind of exercises, and it's quite effective. Then you have a virtual surgeon, medical realties, which is using virtual reality to actually overlay some of the data when you are practicing, for example, doing surgeon. So it can be used for education, but also you are starting to see application for real-time operations where you project the data into the operation so that you can actually be guided by the augmented reality while you are doing the actual surgical operation. And then the last one, very excited about this one, enhance. How can we use the AR to enhance life? So ClassChair is using augmented reality that basically this person is looking, and based on his eye movement, it is steering the wheelchair, so and providing also additional information. So a really great one. You don't need to actually try to use your hand, which if you are handicapped or some other, you can use your mind and eyes and steer the wheelchair, and this way have a much better life and easier movement around. So 5 trends, artificial intelligence, proactive care, data liquidity, blockchain, and AR, VR, that are among a number of others, I'm sure, hot in the industry, where the investments are pouring. And you can take number of these, especially those more hardcore technology like blockchain, data liquidity, etc. Will be interesting to see that these early experiments, which one are going to get into real scale and which are going to require some help from the governments to push them in these areas or even drive it, because governments are big investors in the healthcare. Why wouldn't they use the modern technology to actually lower our healthcare cost and in that way lower our taxes? So with that, thank you. Hope you got some ideas from my presentation.
Thank you very much. As the panel for the next session is getting ready, so a few more questions just to get. So how do you see, as you said, you primarily do not invest in health and well-being. That's not your primary, but how much of the deal flow you see is, let's say, from this sector, what you see yearly?
Yeah, absolutely. It's a lot, and you walk out of the door here. So there are a lot of companies in here. As a trend, I think one of the thing is that what I would like to see more is this kind of fundamental innovations that are either technology based or then solve these big problems of like this data liquidity, connecting the data and those who need it, which are very challenging to solve because you have already so many gadgets that one more pulse meter or something else metering your body, it's not going to cut it, and it's not very differentiating. So I think more of this focus now on the fundamental problems or fast application of the other fields like this machine learning, what can we do with that in the space of healthcare?
Do you find that the startups of today can fill this gap, or should some kind of a, let's say we had Philips just speaking, like the big corporations, is there some element that we are lacking from the ecosystem that should be more innovative in this category?
I think something that I've been now advocating a lot is the working with the startups and the big corporations, because if you look at the R&D investments in, just take a Finland, they are going like this for big companies. At the same time, our VC investments are going like this. So the innovation is moving globally into startups. Just follow the number of unicorns, which the space is accelerating. And in this way, working startups, connecting startups and big corporations together in a way that where you basically you get the idea, why don't you go and try it out with somebody rather than strategizing too long. It's a trend. Corporate venturing is one of the big trends in the world, and so more of that also in the space of healthcare.
Very good. So you're one of the players in matching these startups to the larger players as well. Thank you very much. Let's continue to the next panel.